Welcome to the studios of Faculty of Communication at İzmir University of Economics. Today we have a very special visitor, a visiting professor from State University of New York Fredonia. Jessica Akey is with us, and we are going to talk about health communication. Welcome, Jessica.
Thanks for having me.
Could you please just, give a brief information about yourself, what you do, and what's your expertise?
Sure. So as you said, I am currently an assistant professor at the State University of New York at Fredonia, which is very close to Buffalo, New York, which is very north, very close to the Canadian border. And I teach for the Department of Communication, and my field specialization is in health communication, and that is any communication having to do with health. And so it really merges the field of, or the social sciences with the physical sciences behind like medicine.
And what is exactly health communication?
Well, like I said, it's any communication having to do with health messages or health issues. So we can look at it in terms of interpersonal interactions, such as between patients and caregivers. So doctors and nurses and mental health professionals, social workers, even your dietitian, physical therapist, anyone in the health field. Or we can look at it on a larger scale in terms of mass media messages, so public health messages that come a lot of times from, say, the government, creating messages urging the public to take some type of health behavior.
And why health communication is very important and is becoming a very popular field?
It's been growing in popularity for several years now, and is now many universities in the U.S. That have communication programs are having health communication programs as well. And the reason why is because it's important to everyone, because all of us have our own individual health to take care of. So it's important just for those interactions that we all have to have. It's important on the public health spectrum as well. And in terms of future jobs, it's also a field that there's lots of room for new jobs in terms of these already established medical or public health fields, but also in terms of medical technology that's being created, and that more people are adapting, and we'll need more people who are very good at communicating and socializing with other people, and being informative about health matters.
And what is your research about?
My research, the field or the specific population that I have the most expertise in is individuals who have eating disorders, and how to best help them, because that can be a chronic, lifelong, and it is a mental illness. I've also done research in regards to individuals who are managing HIV or AIDS illness, and a little bit about female athletes, so just athletes in terms of them maintaining their health, and also organ donators.
And why did you specifically choose this field? I mean, there are lots of, fields in communication, but why you focus on this one specifically?
I just have a passion about health. I'm just really interested in the different, we all sort of do, right? I mean, it's just so popular, topics about losing weight or eating the right foods or doing exercises. So I'm interested in those topics, and I'm interested in why human beings make the decisions that we do that are sometimes not in our best health interest. I mean, myself included, we all, don't do everything perfectly in terms of our best safety and health matters. So that's why health communication was a good fit for me, because it does have that component of health and medicine, but also just the nature of human behavior and, and the way that we communicate.
And why in medical field communication is very important?
Well, because in the world of medicine, and for those who say go to medical school and become specialists in certain things, this emphasis of communication oftentimes is lacking. So there's lots of scientific information that they have, but actually communicating that to the public is that's what this field really covers. And so that's really important because a lot of us are health illiterate. We, and it's because we didn't have the same education as those in the medical field did, or many people don't have much education at all, or they come from different cultural backgrounds and, don't value the same things that the medical community values. But everybody deserves a long, enjoyable life. So health communication is a way to try to make sure that all the scientific research that's done in regards to health and medicine gets relayed to everybody.
Mm-hmm. And as far as I understand it correctly, it is about the public health, but also it's about the individual health, right?
Mm-hmm.
And that covers the relationship between the doctors and patients,
Mm-hmm.
right?
Yeah.
And then what is an ideal relationship, the communication between these two parties?
Well, what research is showing now that works the best is it's called a patient-centered communication style. And that's one in which the interaction between the provider and the patient takes into consideration the patient's unique perspectives and opinions and feelings. So in regards to what they want out of their own health, and also creates a relationship between the two parties so that it's not just something that you go into, you find the information out, something hurts, the doctor tells you what it is, and then you leave, and that's it. But that, you can talk to each other about other factors as well. So it's changing from what was called the biomedical perspective to a biopsychosocial. So in one, it just sort of looks like at a person like a car, and the doctor's the mechanic. So something's wrong, this is what it is, okay, goodbye, that's it. Whereas biopsychosocial, it looks at also the psychology, so the mind and any type of mental illness or emotions that are being felt, and the social world as well. So it also, that it gives patients an opportunity to explain not only that, my headache, I'm having migraine headaches and, that hurts, but that it's affecting my career. I can't go to work, that it's affecting my home life. I'm being short with my children. So it's more fulfilling for both the patient and the provider. And then lastly, another component of the patient-centered is just that the patient also has a say in his or her own treatment, so that the patient can make decisions about courses of treatment and things, rather than just, okay, something's wrong, here, do this. Sometimes the doctor may know, right, that aspirin, this will help your headache, but perhaps someone wants to take a different route. Perhaps the aspirin, they have an allergy, or it makes their stomach upset, or they want to try a different method. Well, in speaking with the doctor can recommend, try some chamomile tea, or, lay down and apply a cold compress or something. Mm-hmm. There's oftentimes many options. So communicating between the two parties allows that patient to hear of the options that there are, so that he or she feels more in control of their own body.
Mm-hmm. And what are your suggestions specifically for the medical professionals?
Well, I would say, to seek out some of this research, if they're not already familiar with it, in terms of ways to just adjust or adapt perhaps their communication styles to meet those types of factors I was just talking about. The medical field in the US in terms of med school is changing in that this health communication topic is being addressed in their medical school training. So that is something that is improving. Whereas typically the med school 4-year schedule was pretty much like sort of a graduate first 2 years graduate school learning, and then sort of clinical application in the last 2 years. But within those first 2 years now, they're also incorporating some more training about these types of skills that are also required now, or that again improve the results for everybody involved.
Mm-hmm. And my last question is about your experience in Turkey, because you're a visiting professor at Izmir University of Economics right now, and I would like to hear about that too.
I'm loving it, absolutely loving it. I've never been to Turkey before, and it is just beautiful. The weather is beautiful, the food is delicious, the people have been so extraordinarily kind, and you know, I don't speak any Turkish, but I've been getting around in all types of settings very well, because people go out of their way to help me, and it's been absolutely positive, and I thank you for having me.
Thanks for, for this interview, and thanks for being here. Professor Jessica Akey of State University of New York Fredonia was with us today, and I would like to thank you all for listening.